Dr. Robert Sewell, who's one of the greatest laparoscopic surgeon, general surgeon, calling from Texas. And I know your interest is in gastric reflux. And I know so many millions of people are taking these Pepsids and medications out there. Tell us a little bit about what you see out there, the effect of it on esophagus, and whether the increase in cancer in esophageal and what you see out there.
Right. Well, gastroesophageal reflux disease is an extraordinarily common problem. There's about between 20 and 30 million people take medication every day for reducing the acid, and the only thing that does is reduce their symptoms of reflux disease. Can you hear me okay?
Yes, I can.
I'm sorry, there was a little noise in the background. At any rate, we have become a population of pill takers when it comes to this disease because the pills work. They stop acid from being produced by the stomach, but they don't stop the reflux of material out of the stomach. And
what causes the reflux, Robert?
Well, there's a sphincter mechanism, a little muscle mechanism at the lower end of the esophagus that keeps food and fluids in the stomach. Once you've swallowed them, it relaxes, allows the food to come through, and then it closes back again. Well, if that sphincter becomes weakened for any reason, and there are a variety of reasons, but if it becomes weakened, then the food and fluid in the stomach will have a tendency to come back up in the esophagus, and we see that in heartburn, regurgitation, even people with chronic cough and sometimes other types of respiratory symptoms, asthma, and so forth. They're all often related to the reflux of food and fluid out of the stomach.
So I love chocolate, Robert, and every time I have chocolate, it's a nightmare.
Right. Well, that caffeine in the chocolate is a major contributor to the problem. It increases the amount of acid produced by the stomach, but it also helps reduce the sphincter tone, and so it promotes reflux. Another common thing that people have trouble with is peppermint. When you take peppermint at the end of a meal, it's really not for the idea of sweetening your breath. It's a traditional relaxer of the sphincter that allows you to belch a little more easily. That's kind of an old age sort of.
So basically, obesity can do it.
Yes, there's a variety of things, and what's the worrisome part of this whole thing is that we just kind of consider, it's just a little reflux here. Just take the PPIs, Nexium or the Prilosec or whatever, and you'll be fine. And the symptoms are often better, but the reflux persists, and it's then a matter of chronic injury to the esophagus, and we are seeing what is called Barrett's esophagus increasing dramatically. If you look at the statistics since 1975, when esophageal cancer, that distal cancer, the so-called adenocarcinoma of the distal esophagus, it was almost unheard of back in the early 70s. Today, it's the sixth leading cause of cancer-related deaths in the United States. And it's because Barrett's esophagus is a precancerous type of lesion, and it is caused by chronic reflux. So